Well, we all know now that not only fentanyl, the latest of these terrible, deadly drugs, but opioids in general have been a scourge on our communities. And in Snohomish County, the county executive is rallying the troops to go after this and try to help people who are facing addiction. So I am glad, as always, to be joined by Snohomish County Executive Dave Summers. Executive Summers, I greatly appreciate that. And we've talked about it before, and I don't want to make you continue to relive it, but this is personal for you because you lost your brother to an opioid overdose. But I would argue that it's also personal for you because I've known you for a long time, and I know you love Snohomish County, and you've had to see this on the streets of your county. So it's also personal to you in that regard, isn't it?
Yeah, it's a huge issue for our county, our communities, families. And it's nationwide, but it's a terrible scourge. And as you mentioned, Ryan, I lost my brother in the spring. He had struggled for many years, but had been actually clean for many years. And fentanyl is a deadly drug. It's quite unforgiving. And in Snohomish County, we're losing close to one person per day to fentanyl this year. So the problem is increasing.
And it's that's a sobering statistic because you just said it's just fentanyl that's killing close to one person a day. Other drugs are still out there and still causing serious problems, but you now have some goals set and some pretty solid ones. So can you give us an idea of what these new goals are and what the approach is going to be to try to tackle this problem?
Yeah, absolutely. So stood up a what we call a MAC group or multi-agency committee, which is really a structure that's we've used before in natural disasters and emergencies, but it brings different agencies and talents to bear. So it includes emergency management folks, public health, human services, public safety, sheriff's office, police departments, other regional partners like cities, and really ask them to develop a set of overall goals and near-term strategies. So what we've come up with really is our near-term actions. There's a lot going on, and there has been for many years, but this is a renewed emphasis, and we're funding this with the opioid settlement dollars that came down from the national level, but settlements with the drug companies. But first is establishing a mobile opioid treatment program, and that's going to allow us to have medically based treatment that's mobile and can be wherever it needs to be in the county to be most effective. And so that's a program that's been used elsewhere. We think it'd be extremely valuable here. So that mobile program is kind of one of our key issues. The other couple things we're highlighting in short term is starting to work with our school districts and get prevention education programs out to the schools. Because, frankly, kids these days, almost from the earliest age, are presented with bad opportunities and have to make good choices. And so we think getting information out into the schools and to kids will help them better cope with things that they have to deal with every day. And that's vitally important because over 13% of our deaths over this last year have been kids under 20, 25 years old. So younger people are particularly vulnerable to this. And then the third point of this short-term effort is really increasing drastically the availability of overdose antidotes like naloxone, getting out to schools, healthcare providers, and frankly, just the public, but getting it out there so we can save lives. You can't help somebody if you can't save their life. And so naloxone and those other drugs are vitally important. So those are some of the short-term things we're doing.
Now, you mentioned the mobile treatment option here, but this is another thing that we've talked about before. The capacity for treatment just isn't there. What's the plan? And I know this is part of it to expand that to make a brick and mortar treatment facilities and beds and space available.
Yeah, well, actually, part of the spend plan too for the um, settlement dollars are providing funding for existing programs and existing providers out there to do exactly that, to increase capacity throughout the county. So the mobile program would supplement the existing sort of fixed mortar and brick programs that are out there, but frankly are underfunded and are um, really not able to handle kind of the wave we have. So we know we need to beef up both the fixed services, but also this mobile will allow us to be more flexible around the county. So definitely helping the service providers that are out there, because the system is being overwhelmed, frankly.
Oh, absolutely. I mean, we've talked about it too when it comes to facilities for homeless people as well. They're all overwhelmed and underfunded, and I mean, it's in part because the problem is so huge. Do you feel like Snohomish County is going to be a model for other areas? When you lay out a plan like this, it's very detailed. Do you think other people are gonna pick up the lead?
Well, I hope so, and we're certainly looking to others too. There's no pride in authorship here. We are taking the uh, best programs that we know of that are shown to be effective from other places, kind of weaving together our own program of different elements. But we think we're being smart about it. We want fact-based programs. We want to know the things are going to have a high likelihood of working, and hopefully this fabric of actions that we're weaving together will be a model for others. And we're happy to work with everybody. As I mentioned, this is just not a county problem. It's regional, statewide, and it's national. These drugs are flooding from all our borders and frankly off the coast and through airports and shipping routes and rails and trucks, and it's quite overwhelming, and we're seeing it throughout the country. So we're happy to work with everybody, and we're happy to learn from anybody.
Yeah, you hit on a key point that I am constantly asking our federal officials about, and that's, what can we do? Ultimately, a lot of it is China sending the precursor chemicals to Mexico. They make the drugs there, and then they find their way across, as you said, every border and from every angle. So that's a big part of the problem. And now, quickly before I have to let you go, too, you also mentioned taking on partners including the cities within Snohomish County. What's been the response from those city leaders?
The response has been good. It's always important that we look on who can do what. Police departments are the front line of law enforcement within cities. Our sheriff's office is front line out in unincorporated county. So we need to have a partnership to have more seamless activities here. And so it's really important that everybody kind of step up and be part of the solution and work together in a smart way. And that's the whole purpose of the MAC group, is to sit down and plan who can best do what, who needs what resources, and implement being very strategic and smart.
Okay, so now that you've laid out this detailed set of goals and plans, what's next?
Well, we keep going. We're looking at developing longer term priorities for treatment. The ones I mentioned are more short term things we can accomplish shorter. But as you mentioned, we need housing to get people off the streets. We need programs then to support them, to help them with if it's their addiction or mental health issues or physical health issues, whatever it is. People need and benefit from having assistance to get out of the circle of decay that they're in with drugs. So those programs, our mental health system, we're working with the state, pushing on the state to beef up the statewide mental health care system. Every person that we encounter that's on the street or struggling with drug addiction has a trauma. There's a problem that underlying problem that needs to be fixed and addressed. And so that's going to take not only local activities and long-term commitments, but also state needs to step up. And frankly, we're very grateful for the federal dollars that have come down, but we're going to need more of that. So it's a huge problem. It's a complex problem, and all levels of government need to respond. And we will be providing support for a lot of the people that are doing really good work in this area and have been for many years. But as we already mentioned, those programs are underfunded. So a long-term strategy, we want to build a whole network of response and care that includes not only government, but private nonprofits, healthcare system, etc.
And of course, looking forward to the day when we can eventually dismantle that network, because we've really made a dent in the problem. Snohomish County Executive Dave Summers, as always, greatly appreciate you taking the time.
Yes, thank you, sir. Thank you, Ryan.